So the irony of, I guess it's not irony, it's a coincidence that I see, women for pelvic pain all the time. And maybe that's why I have a lot of empathy and compassion for them, because I felt a lot of it myself my whole life. But even though endometriosis was always on the fringe of my thinking, I'm like, that's whatever. That's not it. I don't have enough pain. But I also didn't have an explanation for all the random pain. So I doubt that the CT scan with contrast is going to show anything. Even if there were adhesions, it's not going to probably be very informative. Maybe if there's a cyst or something. But that's part of the frustrating part. And so if you have landed in the ED or ER, lots with similar type of pain, hopefully this is kind of validating, right? That it takes a long time to get a correct diagnosis, but I think in this case it's time to start digging down to the bottom of it, because all the pelvic pain that usually goes with endometriosis, if that's what it is, I don't know what it is yet, since I treat it every day, maybe that's what's kept it tamped down and self-managed, where I've never landed in the ER before for pain. I've just self-managed it. But now it's time to get to the bottom of it. So I'll making this video so that maybe this will help someone else who's going through it, to know what questions to ask and how to advocate. So when I came in to the ED tonight, I went ahead and gave them my whole spiel of differential diagnosis. I was not having any shenanigans where people were pushing me around, telling me, it's something lame like constipation or musculoskeletal. It's not. I manage people's bowel and bladder issues every day. It is absolutely not that. It's absolutely also not musculoskeletal. It's very strange. But some of the other, issues with women's health, like endo, would fit this. So when I came in, I ran down the line. And so if you're having these symptoms, here's what mine are. Very specific pain that shoots through the abdominal cavity. I had diffuse abdominal pain earlier this week that kept me up several hours during the night with no real explanation for what it was. And it was transient and it went away again. Keep in mind, I'm doing all the lifestyle stuff, good sleep, mindfulness, anti-inflammatory eating. I'm already gluten-free. I've already eliminated all dietary triggers. So it was diffuse pain through the abdomen that I could actually get to anteriorly, pressing through the abdominal cavity down towards the psoas next to the lumbar vertebrae, and then it would radiate sharp down and through and back to the front side of the sacroiliac joint. And by the way, I'm starting to feel a little bit better because I have some pain meds. I have turned them down until 4 a.m. So after 6 hours, I was like, okay, fine, I'll take pain meds. So it was shooting through to the front side of into the sacral ligaments. It's not muscular. And yet the pain is so severe and sharp, I cannot bear weight on the right leg at all. Deep breathing increases the pain. So there's a diaphragmatic connection somehow, And I know that I've had scar tissue up and around and deeply embedded around the respiratory diaphragm on the right side. And all this is very point specific, right-sided, all the way down over the right ovary area. So psoas to respiratory diaphragm to sacral ligament to ovarian connection. So we'll see what happens. I'll keep you updated.